Welcome to today's video session. Today we're going to talk about ovarian PRP treatment, which is one of the treatment methods that we offer women with premature ovarian failure or women in more advanced age brackets. Let me walk you through the structure of this PowerPoint presentation. We're going to introduce with what platelets are, what PRP is, and how it's done. We're going to go over the process, the timeline, and we're going to meet the team at the end of the presentation. The process and the timeline are kind of overlapping in a way because ovarian PRP is something that requires a certain period of time for it to work. So we're going to walk through all of these in a little bit. So why do we need ovarian PRP? This is just to give you a basic brief introduction of why ovarian PRP has come about. Essentially, what we're dealing with is a declining ovarian reserve. So every woman is born with a finite set of ovarian reserves, and even before they're born, these reserves start to decline in number. So even though we're looking at about 7 million follicles at 4 months of gestation, so before a girl is even born, the ovarian reserves reach about 7 million. But once the baby is born, this goes down to about 2 million follicles at the time of birth. So there is quite a lot of wastage. So we don't necessarily know why the ovarian follicles are being wasted at this high rate, but this is the case. So when a baby girl is born, they're born with an average of 2 million follicles. And this keeps declining even if ovulation starts at the time of puberty. The ovarian follicles keep declining in number. So this is pretty much what we're looking at. At the age of 18, 19, we're looking at about 100,000 follicles in the ovarian reserve. So comparing this to 2 million that you're born with, 100,000 at the age of 18, it's quite a reduction. And there is quite a large decline. If you look at around the age of 38, you see that the decline becomes more rapid. And at the age of about 48, 49, you're looking at about 100 follicles in the ovaries. But of course, even if you do have these 100 follicles in the ovaries, they're not necessarily good quality oocytes that can give you pregnancy. So that's something else to keep in mind. So what kinds of options are we looking at in terms of treating women in older age brackets or women with low ovarian reserves? Because these two are not necessarily the same thing. You can have a 20-year-old woman with a premature ovarian failure, or you can have a 45-year-old woman with still a high level of activity in the ovaries. So these are not the same thing. So what kinds of options are we looking at for women with low ovarian activity? Essentially, ovarian PRP, which we're going to discuss today, is one of them. Another option is using donor eggs. So you can go straight to donor eggs if your ovarian activity is low and you're not having success with IVF cycles. And one other option is embryo banking. Embryo banking is the method of IVF that we do when we do a number of cycles of egg collection, and then we combine all of the embryos together in the end and select the best ones to transfer. But we're not going to discuss those today. Those are for other videos. So let's get to the function of platelets. Now, platelet-rich plasma, which is the longer version of PRP. PRP is the abbreviation of platelet-rich plasma. Has come about because of the tissue regeneration effect of the platelets. Platelets are also known as thrombocytes, and these are the part of the blood which help with tissue regeneration and wound healing. And PRP is the product where we centrifuge the blood and we separate the plasma from the red blood cells and whatever sinks at the bottom of the plasma is the part which is rich in platelets. And in terms of the function of platelets, we've mentioned wound healing, tissue regeneration, and this is due to the growth factors that are present in platelets. These growth factors such as EGF, VEGF, TGF-beta1, TGF-beta2, and also PDGF, IGF-1, HGF. I'm not going to bore you with the details. These are this is a lot of jargon, and it's not very necessary to understand the process anyways. But this is just so you know, there are several growth factors involved in the process of platelets. And this is how wound healing and tissue regeneration is possible with platelets. So this slide is just to give you an information of what each growth factor does and what they're involved in. And the same thing. For example, this is just to give you an example. For example, you may fall, you can have a bruise, you can have a cut, and what happens is this initial bruising ends up being inflamed. So there's an inflammatory process. This inflammatory process becomes edematous. And later on, you see a yellow layer which is formed on top of your bruise, which involves blood clots, blood cells, white blood cells, platelets, and growth factors. So these initiate the inflammatory process, which is essentially aiming to prevent excessive bleeding, prevent an infection, and they do help with the regeneration of the connective tissue, and they try to help repair the damaged area. So when you cut yourself, when you bruise yourself, you see this yellowish skin color turning purplish or greenish. These are the inflammatory processes that help with the regeneration of the tissue. And how is this connected to ovarian follicles? How did we make the connection between this and ovarian function? Well, in terms of regeneration of the tissue, in terms of regeneration of the cellular lines, we know that there are dormant cells in the ovaries, especially in the ovaries of younger women with premature ovarian failure. So even though there may not be ovulation, even though there may not be a full cycle of oogenesis, a lot of women still have a decent size of primordial follicles in their ovaries. And these early stage follicles, they don't necessarily commit themselves into oogenesis, into ovulation. So the purpose, the aim of ovarian PRP treatment is to help get these primordial follicles reach the ovulation stage. In healthy ovaries as well, for example, in women who do ovulate, who are younger in their 20s, 30s, who have healthy ovulations, they do have a lot of primordial follicles. And in these women as well, we see quite a wastage of these primordial follicles. So with every menstrual cycle, about hundreds of primordial follicles are prepared for ovulation, are prepared to undergo and complete the stages of oogenesis, but they simply waste away, and we end up with only one or maybe even two follicles that reach the stage of ovulation. So as you can see, there is almost 98-99% of wastage in the follicles that are being prepared for oogenesis, but they don't necessarily go through these stages. So these primordial follicles are wasted away. And in women who do have a decent size of primordial follicles, and which includes women with premature ovarian failure, or women in older age brackets who do still have some sort of ovarian activity. So with these women, we can essentially try to stimulate these primordial follicles, and they can possibly undergo the stages of oogenesis and complete the stages of oogenesis and give us viable follicles, give us viable eggs that we can work with. Okay, so let's talk about the process. This is a cross-section of an ovary, and it shows us the inner part of the ovary, which is called the medulla, the outer layer, which is called the ovarian cortex, and the other structures and the follicles as they grow. Now, the follicles, the stem cells, the primordial follicles, the primary oocytes, and all the rest of the follicle lines exist in the ovarian cortex. So whatever you're going to do, whatever action you're going to take to promote follicular growth has to involve the cortex. So a few considerations for ovarian PRP would be the method you're using, the location, oogenesis and timing of your treatment, and what kind of supportive treatments you can provide the patient so that you can actually help with the stages of oogenesis. Now, in terms of the method, a whole blood sample of the patient is obtained peripherally. So this is just like getting a blood test. So your blood sample is obtained and is subjected to laboratory processes so that the platelets can be isolated. But before this is done, the blood sample needs to be anticoagulated, so that we can avoid premature activation of the platelets, because platelets exert their activity once they're active, once they're activated. If they spontaneously activate themselves before you inject into the ovaries, then they're not going to work. So anticoagulation is a vital process here. In terms of isolation protocols, this also is quite important because not every lab is able to isolate platelets as effectively. So this is one of the key factors in success. And the correct timing of activation. The inactivated platelets that you processed need to be activated prior to injecting into the ovaries. So the precise timing for that is also quite important. The location, I've mentioned this briefly in the previous slides. The cortex is where you're going to find the primordial follicles. So any treatment which aims to help activation or differentiation of these cells, it will need to involve the cortex. So you inject 1 cubic centimeter of PRP, and this can be combined with exosomes as well. Exosomes help with cellular communication. So when you inject PRP along with exosomes, it even gives you an even better chance of success. So during the PRP injection, we use a transvaginal catheter, which is very similar to the catheter that is used in egg collection or oocyte pickup procedure. But in this case, we're not trying to retrieve oocytes, we're trying to inject something into the ovaries. So we reach the tip of the cortex and we work backwards so that we can ensure full coverage of the cortex with the PRP that we're injecting. In terms of oogenesis, we need to be careful with what to expect from the PRP, because PRP aims to recruit dormant stem cells or the primordial follicles, more so with the primordial follicles. So you need to be aware of the timeline involved in the primordial follicles reaching the stage of ovulation, because if you do the IVF cycle after PRP too prematurely, then you're not going to see the full benefits. If you wait too long, then again, you're not going to see the full benefits. So it's quite important that you time an IVF cycle after an ovarian PRP treatment effectively so that you can get the full potential. So this is basically a visual which shows the stages from stem cells into the primordial follicle, into the primary follicle, the secondary follicle, antral follicle, and then going into ovulation. So these are the stages of follicular growth. And here is a different visual which actually shows the timeline. So as you can see, from the resting stage, which is the stage where we have the stem cells. So if you are able to recruit stem cells into ovulation, it takes about 120 days. Now this is something that we may be able to see, but it's quite more difficult to recruit stem cells into ovulation, into oogenesis, compared to the primordial follicle. So our aim with the PRP is predominantly with the primordial follicles. So as you can see, here is where you would expect the primordial follicles. So here the preantral follicles, they need about 65 days to reach the stage of ovulation. Here with the primordial follicles, you're looking at about 80-85 days until they reach the stage of ovulation. So 80-85 days would be 2.5 cycles away. So when the ovarian PRP is administered in the half of a cycle, for example, if it's a patient who does have menstrual cycles, we would plan the ovarian PRP mid-cycle around day 15, 16 or so. And we would proceed with the IVF cycle on the third menstrual period that they see. This would give us about 80-85 days until this stage from the primordial follicles into ovulation. So this would give us the time frame that we would need for the primordial follicles to grow and become larger eggs that are viable and that can give us embryos. And let's briefly touch up on the supportive treatments that we also incorporate into our PRP procedure. One of them is using human growth hormone, which has been shown to support cellular growth and differentiation of the follicles. And I've provided a couple of links for you for your own reading. There are articles available which show clinical studies that have demonstrated success with human growth hormone, and the same is valid for myo-inositol, which is also associated with an increased number and quality of oocytes, especially in poor responders. So we also incorporate this into our protocol, and we have our patients use these for a certain amount of time before we plan their IVF cycle. Again, I've listed a couple of articles there for you to take a look at if you're interested in reading further about these two supplementary treatments. Okay, let's talk about success rates. So what do we know about success of ovarian PRP? Now, so far, we've treated about 237 patients with ovarian PRP treatment. It's actually more than that, but we've kind of kept statistics for the 237 patients. And 101 patients out of these 237 were under the 35 years of age limit, and they were diagnosed with premature ovarian failure. So we've separated the statistics into women with premature ovarian failure and women in more advanced age brackets. So the women with premature ovarian failure, out of these 101, 6 of them actually experienced spontaneous pregnancies and healthy deliveries. And 21 patients scheduled an IVF cycle with us, and 7 of them ended up being pregnant, which is a 33% chance of success. Now, when you think about a 33, 34-year-old woman with 33% chance of success, that may not be too great. But considering that these are women with premature ovarian failure who had undergone IVF cycles without success or couldn't even go through an IVF cycle because of no follicles developing, no eggs developing. This is actually quite a dramatic rate of success. In terms of all patients in older age brackets, 64 patients were over 43 years of age with an AMH level of 0.2 or greater when measured in nanogram per ml. So this is an ovarian activity level which could be acceptable for women in these age brackets. So patients who did have some level of ovarian activity and who were older than 43 years of age, 3 of them actually experienced spontaneous pregnancies, and 39 patients scheduled an IVF cycle with ourselves, and 5 of them became pregnant, which is a 13% chance of pregnancy. So considering pregnancy rates in women over 43 years of age, 13% is actually quite a good number. And again, keeping in mind these are patients who've gone through IVF cycles before, who've gone through other treatments before and couldn't get success. And in terms of the timeline of treatment, we would obviously need an initial testing. If this hasn't been done, we would need to see the hormone levels. We would need to see a semen sample from the male patient just to make sure that there isn't something there and that's not the cause of the failed cycles before. And we would plan your ovarian PRP cycle according to your menstrual cycle status. So whether you're seeing your menstrual cycles or not would also be decisive in when to proceed with the ovarian PRP. The treatment itself would involve obtaining your blood sample and processing it in the lab, injecting the ovaries, and then after the treatment, we would prescribe you myo-inositol, HGH, and then we would ask you to retest your AMH level, get another scan, measure your hormones, and then we would plan your IVF treatment on the 3rd cycle after the PRP treatment. So this is pretty much it for today. This is our core team. The rest of our team will be happy to help you. And for any questions you may have, you can always email us or log on to our website at northcyprusivf.com.